Understanding Panchakarma, Susruta Ayurveda. Hello viewers. Welcome to another informative video. This video is about the very well-known topic Panchakarma. Panchakarma as the word signifies panch means 5 and karma means an act/procedure. So, we can call it a package of 5 procedures: Vaman, Virechana, Nasya, Basti, and Anuvasana Basti. We will discuss these terms in detail, so please watch the video till the end. It can be performed by both healthy and diseased individuals. Healthy persons perform to maintain their health and to avoid illness, while diseased persons are aimed to cure their disease. Before heading towards Panchakarma, your doctor will do some pre-procedure things, which will include Detoxification, Snean, Sweeten, Detoxification. It is a type of preparative phase to equalize the digestive fire, as good digestive fire is necessary to digest the drugs which will be given in main procedure. Drugs like Trikatu, Panchkola, Sunti or Chitraka Churna are given as per need. These drugs are given until the appearance of Nirama Lakshana of dosha or Kastha Sati. Snapana or oleation is carried out for smoothing and fluidity of body organs. It is done internally by oral indication as well as externally through massage. It is essential as it dislodges harmful substances from body. Oral intake of sneha, ghee or oil, is digested as per Detoxification given earlier, so it is an indicator of your digestive fire level. Materials for snana are grita, tela, vasa, or matcha. Dietary indication during snana is ahara, which has a more liquid quantity, warm in nature, and is lighter to digest in moderate amounts. Digestion period may be 6, 12, or 24 hours, which be recognized as risaya, madhyama, or pravara matra, in other words little, moderate or large quantity. Regimen during snapana. You should use only warm water for drinks and baths. You need to follow brahmacharya, complete rest without day sleep, do not suppress the natural urges for defecation, urination, flatus, irritation, etc. Avoid exercise, loud speaking, anger, anxiety, extreme cold and heat, and well protected from the wind. If you do not follow the prescribed regimen, it results in severe disorders/complications. Svedana or steaming. In Svedana, steam is applied locally or whole body. Svedana therapy helped to relieve the factor of stiffness, heaviness, and coldness. Vaman. Vam means to vomit, spit out, or eject from the mouth. It means ejecting, spitting out, vomiting, giving out, emitting, and issuing out. Vamana is a process in which morbid dosha are eliminated through upper channels, i.e., mouth. It is conducted when kapha and pitta become eukalishta and comes into amasaya, which is the main site of kapha. Excessive cases wherein the levels kapha is raised in its own sites, or kapha combined with pitta or vata, which is present in a small proportion. Vata or pitta invading the sites of kapha. Vamana karma is indicated in all conditions of bahu dosha, like indigestion, anorexia, obesity, anemia, heaviness, malaise, acne, boils, leukoderma, or similar skin diseases like itching. The procedure starts from the period of oral administration of Vamana Dravya and completes with the stopping of Vamana Vika. There is a need for keen observation during the period of drug intake, during the ejection of drugs, and after the Vamana karma. Both Vamana and Virechana is followed by a strictly specific diet, as due to this karma digestive fire or body gets lowered, so a specific regimen is followed called Sansarayana karma. Virechana karma, It is a type of medicine-induced purgation which is generally done to cure kapha and pitta dosha-related disorders. In Virechana, the vitiated doshas are eliminated through the rectum. Prior to Virechana, oleation and steam is given in a systematic way, then a drug is selected as per need to bring the vitiated doshas in the abdomen. Drug-induced purgation, whose count may be as high as 30 or may be less than 10 depending on the efficacy of the drug and the demand of the disease. Indications include pitta conditions like skin disorders, blisters, abscesses, liver disorders, etc. Or condition where pitta is associated with kapha, where pitta is the dominant dosha, as in certain types of vomiting, acid peptic disorders, etc. Or pitta associated with vata, as in the case of gout. Other anomalies include non-healing wounds, infertility, obesity, etc. Benefits: Virechana therapy is recommended and is highly beneficial for the following: detoxification in case of accumulation of pitta dosha. Eliminates toxin accumulation in the GI tract. Effective treatment for piles, constipation, acidity, ulcers, liver/spleen diseases, jaundice, inflammations. Cleanses body from poisoning. Cures mild and chronic skin disorder. Relieves headaches, anemia, pain in the large intestine, and non-healing wounds. Helps manage diabetes, asthma, and heart diseases. Reduces gynecological disorder. The Virechana Ayurvedic detox program, which may take 3 to 8 days, is also safe from any side effects. Anuvasana and Narua Basti. These are both procedures, and basically medicated enemas are given to correct the doshic level in the body. It has been said that this particular therapy exterminates the disease invariably and leaves no chance for it reverts. Basti holds a distinct position in contrast to other Panchakarma measures because of its wide spectrum and competitive benefits. Basti is a procedure in which the drug prepared as per classical reference is administered through the rectal canal, reaches up to the level of the umbilicus or possible extent in the intestines, and spreads the unctuousness, potency of the drugs, all over the body and easily comes out along with the churn purisha, stool, and doshas, toxins. Classification of Basti according to drugs used. 1. Naru Basti. This type of Basti mainly contains kashaya, decoction. 2. Anuvasana Basti. In this type of Basti only sneha is used. According to the quantity of oil given, this type is subdivided as A. Sneha Basti, B. Anuvasana Basti, C. Natra Basti. Nasya Karma. Nasya Karma is one of the Panchakarma procedures in which medicines like Kwatha, Swarasa, Kalka, Sneha, etc. are administered through the nasal route, is known as Nasya Karma. It is used for the purpose of lubricating the head, giving strength to the neck, shoulder, and chest, and producing clarity of vision. Indicated in tension: headache, hair fall, falling of tooth or mustache, intense earache, disease of the nose, dryness of mouth, frozen shoulder, premature wrinkles on the skin, or graying of hair. Preparation of the patient: You will be advised to be devoid of natural urges like urine and stool. Abhyanga, massage, then advised to lie down on Nasya's table. Redo Abhyanga will be done on the scalp, forehead, face, and neck for 5-10 minutes with medicated oil like Masha Tela, etc. Swedana, sudation. According to Ayurvedic classics, Swedana should not be given to the head, but Mridu Swedana can be given for elimination in a supine position with ease on the Nasya table. Shira, head, will be lowering or head down position and feet slightly raised. After covering the eyes with a clean cotton cloth, the doctor will raise the tip of the nose with his thumb, and the lukewarm medicine would be dropped in both nostrils alternately in a proper way. The drug should be neither less nor more in the dose, i.e., it should be in the proper quantity, neither very hot nor very cold. We can say that it should be lukewarm. You have to remain relaxed while taking Nasya. Also should avoid speech, anger, sneezing, laughing and head shaking during Nasya karma. After giving Nasya, you have to remain in the supine position for a minute, time of counting up to 100. After administration of Nasya, shoulders, hands, feet and ears will be massaged. Again, mild fomentation will be done on the throat, cheeks, and forehead. Sweetena is given on the head, cheek, and neck so that oil dropped in the nose may drain out along with the morbid dosha, especially mucus, and a portion of the medicated oil should leave behind. The patient is asked to spit out the drug which comes into the oropharynx. Care should be taken so that no portion of medicated oil is left behind. Patients should be advised to stay in a windless place. Patients should take deep inhalation by both the nostrils and expel the morbid doshas, kapha/mucus, from the mouth. Medicated Dhumapana and Kavala are advocated to spit out the residue mucus lodged in Kanta. Patients should stay at Nivedasthana, please devoid of wind, Lagu Ahara, light meal, and Sukoshna Jala, lukewarm water, is advised. Patients should avoid dust, smoke, sunshine, alcohol, hot bath, riding, and anger. Excessive intake of apishayanta, sniyukta ahara, madhya, and dravapana should be avoided. Day sleeping in cold water for any purpose like pana, drink, snana, bath, etc. should be avoided after Nasya karma. It was an AI-generated video, so pronunciation of some words may vary from the original. Please read the text also shown on the screen. To get more clear knowledge, please consult your Ayurveda doctor or visit our site to take an appointment. Link is in the description. If you like the video, please subscribe channel Susruta Ayurveda and like and share it with your friends.